Proper oral hygiene is important for a bright, healthy smile, but brushing your teeth can help fight other diseases as well. So you want to be sure that you get it right. And Dr. Martin Goebbel of Southern Blvd Dental is here to show us the do's and the don'ts of brushing and flossing. Good morning.
Good morning.
Good to see you.
Nice to see you.
Can you brush too much? I think I might brush too much. I brush like 3-4 times a day.
No, you really can't brush too much.
Okay, good to know. Because, well, this is another thing. I was researching the entire segment that we're doing today, and what I read was that the Surgeon General estimates 85%, that's a big percentage of Americans, have gum disease. I mean, that's unbelievable to me. So why do you think that is? Is it just plain laziness, or is it just that we're not brushing correctly?
Brushing correctly is probably one of the reasons. Not brushing enough, not knowing your situation. Again, heredity has a big deal to do with it.
Oh, it does?
It does.
So if your mother or father have gum disease, there's a good chance that you will as well?
Exactly.
Even if you brush and do all the right things?
Well, somebody that's got the genetic history needs to be brushing 4 or 5 times a day rather than once or twice.
Okay, that's good to know. Well, okay, so tell us why it's so important. Obviously, we want to maintain good oral hygiene. So,
well, everybody's mouth has at least 500 types of bacteria.
Well, that's kind of scary when you say it like that.
And they love to grow in there. It's moist, it's warm, you know. Bacteria are negatively charged.
Okay.
Your tissues, your gums, your teeth, your tongue are all positively charged.
Okay.
So just like magnets that stick together.
Like a reaction.
The bacteria attach to the tissues and the teeth. And when they do, they form what's called biofilm.
Okay.
We used to call it plaque.
Right.
It's a combination of bacteria and food debris that's left.
Okay.
Well, if you leave that sit on your teeth, the bacteria produce toxins as they eat the foods that are left there. And in doing so, they either cause cavities, certain types, and the other types of bacteria will cause the gum disease.
So we know one of the solutions is to brush, but you said if you have a genetic history where there's some problems, you might want to brush a little more excessively. What's the typical person's daily regimen as far as brushing goes? What would you recommend?
Well,
how many times?
It just depends on the person.
Is there a minimum?
There are some people that can brush once a day and be fine.
Really?
There are others that need to brush 4 or 5 times a day.
I mean, I would think at least when you wake up and before you go to bed.
That's the norm.
Yeah.
I mean, that's the average.
Well, will you show us the right way to brush? Because, you know, we hear so many different things and we've got so many toothbrushes to choose from. And so let's start first with the toothbrush itself. What kind of toothbrush should we choose and why? Because I look in those aisles and I'm like medium, thick, bristle, long, short. I don't know. How do I know?
Okay. We have electric toothbrushes.
Right. And
I think there's a slide for these.
Okay.
There's different shapes, there's different sizes, there's different ways that they work.
Right.
They range in price from $10 to about $200.
Yeah.
This one will time you. This one, if you put too much pressure on, will stop. This one, it's got a brain.
It's like cruise control on your teeth.
Exactly. So, electric brushes work much better to remove the biofilm from the teeth.
Okay.
Okay? They don't tend to massage gums as much.
Okay, so you gotta find a balance.
Sometimes you need to use an electric brush one time and a manual brush another time, or some type of gum stimulator so that you get massaging in the gums to help with the gum disease problem.
So to get that in the gums, what would you recommend? A specific type?
Well, I was gonna show the brushing with the brush.
Okay.
Your best bet. First of all, when you see these commercials for toothpaste, they put a blob of toothpaste the whole length of the brush.
Yeah.
You need about the size of a pea for an adult.
See, that's why I'm always buying toothpaste.
And for a kid, you need half that.
Okay.
Okay?
Good to know.
Your best idea is to brush the biting surfaces of your teeth first. And that will help spread the toothpaste all the way around. And that toothpaste starts to work on the biofilm. And then you come back, and these electric brushes tend to make you brush one tooth at a time. And you just work your way around. Now, again, that does a much better job on the tooth surface, but it doesn't do justice to the gums.
Right. So for the gums.
Other brushes.
Yes.
You've got all kinds of shapes and sizes. And Small ones, big ones. When you're brushing,
How do you know which one to pick?
you want something that feels comfortable to you. You want a small brush because it can reach areas better.
That's like the one I use.
The handles, they've got all different kinds of handles, okay? When you use the manual brush, again, you start with the pea size of toothpaste.
Okay.
You will brush the biting surfaces. Then when you use a manual brush, you actually use a 45-degree angle like this and work the bristles between the tooth and gum.
So you're doing circular, so it's not up and down or across, it's circular?
You start circular first, okay?
Okay.
But what helps with the manual brush is that you can set the bristles to the side like this and then rotate up.
Oh.
So then you're actually massaging the gum tissues.
I see.
Some patients that have gum disease, I will tell them, leave a toothbrush on your coffee table. When you're watching TV at night, just dry brush.
Interesting.
And massage your teeth.
Good tip.
There's small brushes like these. These are called interproximal brushes. They can work between the teeth to help clean.
Oh, I've never seen those.
Now, they won't fit in everybody's teeth. If you've had some bone loss from gum disease, then they will fit.
Now, what about brushing your tongue? Is that something that you recommend?
You definitely have to brush your tongue.
Okay, because I do and I never know if that's the right thing.
If you look at your tongue under a microscope, it looks like shag carpeting.
That's kind of gross.
Bacteria love it in there. Okay?
Yeah.
The best thing to do is scrub brush your tongue.
Okay.
And you can push pretty hard on your tongue.
Okay.
Again, when you're using a manual toothbrush, I recommend a soft brush. The bristles,
Okay.
the bristles will get in between the tooth and gum a lot better, and the softness will help to massage the gums better.
Very good. And that's something that you would recommend to everybody, no matter what?
No matter what.
Soft bristles. Okay, that's good.
Okay.
And you know what, real quick, I want to also add that I read that having gum disease can actually quadruple your risk of stroke and heart attack by releasing plaque into your bloodstream, and I had no idea about that.
Exactly. What happens when you're brushing, if you get bleeding in an area, it's your gums crying to you. Get in here and clean me. It's like a dirty cut on your finger that bleeds. If you don't clean it out and keep it clean, it's going to allow infection to enter your bloodstream.
And that's certainly a bright warning sign.
And when it does, it creates an immune response with the formation of C-reactive protein that causes this increased risk of stroke and heart attack and colon cancer and Alzheimer's, and it goes on and on.
So oral hygiene really is more important than we even realize, and we want to make sure that everybody knows how they can find you, Dr. Goebbel. They can always go to 2716 Southern Boulevard Southeast in Rio Rancho, or go to the website at sbdental.com, and you can call the office at 505-892-8600, and maybe next time we'll talk more about flossing as well, because we got the
flossing
brushing.
and some rinses and
Brush your teeth, people, with the soft brushes at least 3 times a day, I say. That's my opinion. And thank you for being with us. Valuable
You're welcome.
information.
Have a great day.
And all new episodes of Kitchen Nightmares with Chef Gordon Ramsay return to 2 Casa Fox this Friday night at 7 p.m. Here's a look at Season 5's premiere.
Fridays on Fox, there's gonna be cussing in the kitchen. Of course, I'm talking about Gordon Ramsay and his 5th season of Kitchen Nightmares.
And this is the chitlins and okra.
Okay, chitlets.